video we'll be discussing a condition called overactive bladder. For most people, going to the bathroom is a fairly uneventful experience. Most people go on average between 4 and 8 times per day. For people with overactive bladder, this can take over their life and they find they need to go to the bathroom many more times than this. Overactive bladder is not the same as a weak pelvic floor. Overactive bladder is a neurological problem. It involves the signals that are being sent from your brain and your spine to your bladder. It also involves signals that are generated by the bladder itself. These cause the bladder to forcefully contract. Sometimes people with overactive bladder may feel that they're not going to make it to the bathroom in time. A common misconception is that OAB affects only women or only the elderly. As it is a neurological problem, any pathology or trauma that injures the spine may result in OAB. It is thought that many people do not seek treatment for OAB. They're either too embarrassed or they don't understand the treatment options or that there's any help available for them. For these people, OAB can be a very frustrating position. Understanding a little of the underlying mechanisms will assist in appreciating the condition and also identifying available treatment options. Throughout the day, your bladder feels a little all the time. Filtered urine from your kidney flows down and into your bladder. Most people have a bladder capacity of about 300 mL, and you won't start to notice the urge to go to the toilet until you've started to reach that capacity. The stretch receptors in the detrusor muscle start to fire more frequently. These send a signal to your spine. In return, a signal is sent back to the detrusor muscle, causing it to contract. Of course, if it's not a convenient time, you can consciously override this signal until it is a convenient time. If you have overactive bladder, your detrusor muscle is overactive and it wants to fire all the time, even when your bladder is only a little bit full. The signals coming back from your spine to cause your detrusor to contract are via a neurotransmitter called acetylcholine. Acetylcholine binds to cholinergic receptors throughout your body as part of the parasympathetic nervous system. In particular, these are called muscarinic receptors, and you have 5 types: M1, M2, M3, M4, and M5. In the detrusor muscle, the target receptor is the M3 muscarinic receptor. Although you do have more M2 muscarinic receptors, these are not as important in targeting overactive bladder. The cornerstone of OAB treatment is to block the muscarinic receptors on the detrusor. A common drug that affects this is the antimuscarinic oxybutynin. Oxybutynin binds to the muscarinic receptors on the detrusor, causing them not to contract. Unfortunately, oxybutynin also binds to other muscarinic receptors throughout your body. This means that taking an antimuscarinic such as oxybutynin will not only affect the detrusor muscle, but also affect other glands to which muscarinic receptors play a key role. In particular, the lacrimal gland in the eye is affected, and also the salivary gland in the mouth. The side effects of taking an antimuscarinic are therefore dry eyes and in particular dry mouth. This side effect can be so uncomfortable and problematic that many patients will be non-compliant and come off medication, preferring their original problem. Advances in the treatment of OAB are therefore looking at medications that preferentially target the M3 receptors in the detrusor whilst having a lower affinity for other M3 receptors throughout the body. It is hoped that the new antimuscarinic drugs will have greater selectivity for the detrusor M3 receptors. These will have fewer negative side effects and hopefully improve patient compliance and lead to better patient outcomes in the treatment of OAB.